Cervical cancer is one of the leading cancers among women, and this has resulted to a lot of our women dying. Hearing this, some men will say that, oh, this video is not for me. However, you may have a sister, a mother, and some kind of friends of yours are women. So definitely it's advisable to watch this video, get this broad understanding information so that you'll be able to share it with them. Basically, cervical cancer is cancer of the cervix, and it affects only women. You understand? It is caused by a virus called human papilloma virus. Now let us look at the risk factors of cervical cancer. When we talk about risk factors, they are the very things that when you do, it puts you at a higher risk of getting cervical cancer. The first one is having multiple sexual partners. If you are one kind of person who changes sexual partners very frequently, as often, it puts you at a higher risk of getting cervical cancer. And the most serious thing is that if you're a married woman and your husband have a lot of side chicks, if one of those side chicks has cervical cancer, it's likely that your husband will transfer the cervical cancer from that side chick onto you. That is the most serious thing. Yes, it's very, very serious. Your husband can transfer cervical cancer from a side chick onto you. You understand? Onto you, the woman. So this means that is very, very serious. Let's continue with the risk factors. One of the risk factors is also early coitus. Early coitus. If you are one kind of person who broke your virginity at a very tender age, at the age of 8, at the age of 9, at the age of 10, it puts you at a higher risk of getting cervical cancer. Also, early marriage is also a risk factor to getting cervical cancer. Also, multiple childbirth. Multiple childbirth also puts you at a higher risk of getting cervical cancer. Let us not forget that when you compare the number of black people, black women who get cervical cancer as compared to the white women, the black women get cervical cancer in a very higher amount as compared to the white. So black race also put us at a higher risk of getting cervical cancer. Now the big question is, how do you detect to know that you have cervical cancer? There are some kind of people, or there are some kind of women who they may have the cervical cancer, but they may not show any symptoms. These are called asymptomatic. They are not showing any symptoms. However, they have the cervical cancer. So the only easy way to detect to know that you have cervical cancer is called pap smear. Pap smear. When you go to the hospital that you want to detect so that you know that you have cervical cancer, they will do the pap smear and they will get to know whether you have cervical cancer or not. However, there are also some kind of people who will show symptoms of the cervical cancer. One of the symptoms of cervical cancer is menorrhagia. Menorrhagia is heavy bleeding, heavy menstrual bleeding. You know your normal blood that comes during menses, but here's the case: if you have cervical cancer, you will bleed beyond normal. You understand? And one of the symptoms is also dyspareunia. Dyspareunia means that when you have sexual intercourse with your husband, you intend to feel pain. You intend to feel pain. We also have postcoital bleeding. After sexual intercourse with your husband, you will see that you will bleed. You begin to bleed beyond normal. You intend to bleed after sexual intercourse. Also, one of the symptoms is urinary issue. Urinary issue. So you begin to have difficulty urinating. Urinary incontinence. Urinary incontinence is being explained as you do not control your urinating. You understand? So if you are there and once your body sense that you want to urinate, you then urinate. You can't control your urination. That is what we call urinary incontinence. So cervical cancer can lead to that. I hope you understand. It also leads to cachexia. Cachexia is losing weight. You begin to lose a lot of weight because cancer patients always lose weight. So cervical cancer can lead to you losing a lot of weight. I hope you understand. Getting this information before we continue with how to prevent cervical cancer. If you have not liked this video up to this end, then I will entreat you to like this video. Also subscribe to this channel for more videos. Let us continue with the prevention of cervical cancer. One easy way to prevent cervical cancer is to annually do the pap smear. Because when you do the pap smear, doctors will be able to detect it at a very early time. I hope you understand. Early detection saves life. If your cervical cancer is being detected at a very early time, doctors are able to treat you so that you'll be free of the cervical cancer. However, if you wait and the cervical cancer becomes severe, then doctors won't be able to do anything serious about it. That is why many women are dying as a result of cervical cancer. The second prevention is female education. female education. A lot of our women need to be advised and given a lot of education about cervical cancer. That is why in today's video I'm giving you this information. So if you're a man watching this video, please, and a new way or another way to get this information to them is to share this video to a female friend, a sister or a mother, so that they too will be educated of this cervical cancer. And also let us also stop the incessant or stop having sexual multiple partners, because having sexual multiple partners will put you at a higher risk of getting cervical cancer. And you may not know that the kind of woman you are with now has cervical cancer, and it's likely that you will transfer the cervical cancer from the woman to your wife who is not in any sexual relationship. I hope you understand.